treat right now because we have Shweta, Rawat, you actually just spoke.
Yes.
And now you're here with me.
Yep.
I want to give you the proper introduction because there's quite a lot of titles right here.
Yeah.
So I want to give you you've earned all of these. You're the Managing Director of the Rural India Support Trust.
Correct.
As well as the Chairperson for the Hans Foundation.
Correct.
So let's talk about your work with the Hans Foundation a bit and why you partner with Americares.
So both our foundations, the Rural India Support Trust and the Hans Foundation, were started in 2009. And the idea was that in India there's a big gap, especially in the last mile communities and villages, between with access to services. So and what we believe is that regardless of caste or sex or gender or education level, everyone should have access to healthcare, everyone should have access to a good school, and if you're disabled, you should have access to services that allow you a better quality of life. So keeping those principles in mind, we looked for partners that had the same mission and the same value, and our partnership with Americares was started in 2012. Today we fund 6 of the 8 medical vans that they run, but the first proposal was just for 2 vans, and we provide primary health care to the Mumbai slums, which are some of the most heavily populated and densely populated communities on the planet, I think. Yeah.
I was speaking with Kathy, actually. She's one of the organizers of this event, and she's helping us out with this live stream, and she was saying that your vans go into the slums of Mumbai about every 2 weeks, and that people are ready, they wait in line, they need the services, and these services are very important to them. What does that mean to you every time you see lives changed by the work that you're doing along with Americares?
Yeah, I think it's incredible to see just the rise in awareness, and in rural communities, especially in I think semi-urban communities in India where there's a lot of growth and explosion, and oftentimes services cannot keep up with that increase in population. Just the fact that they have this reassurance that a doctor is coming to see them every 2 weeks, who really is invested and interested in their care, and not only is he seeing them and consulting with them, but he's providing a follow-through plan of where to go if there's a second level of referral needed. And India has a lot of invisible diseases, what we call. Diabetes is a big issue, hypertension, heart disease. So these are things that you only really find out about and can actually improve if you do consistent follow-up care. So the people know that 2 weeks later the same doctor will come back and check in on them, and I think that allows them that kind of comfort, and then they take their children with them, they get the communities involved. And Americares today has really, they have an amazing relationship, an amazing reputation within the community they're working because they've been there consistently.
Education,
exactly.
Yeah, access, commitment.
Yep,
all
exactly. Education and access, and they've branched off. They've seen how the communities, what kind of care is really needed, and for us, we have that flexibility in our funding that looks at our partnership and says, well, let's think about this also. So, we've tried to include electronic management of all their records. So it's something that any doctor, any referral doctor can access from anywhere. And so we asked them to tweak the program with that. What I'm looking forward to is a landscape study that we've asked Americares to complete of just the actual effectiveness of the project that we set out and did together, the mobile medical unit. And I think it's going to be the first of its kind in India. Nobody's really looked at the MMU effectiveness, and that hopefully will be completed soon at the end of this year.
It's incredible how technology can help save lives in real time.
Yeah, absolutely.
I want to know what keeps you optimistic about improving the health crisis in India, and what are some successes that have inspired you over your time working with these organizations and working with Americares?
Yeah, so I am very optimistic because I think that given the right access is key to so many things, and our foundation in India, we work with over 200 partners, and we've been funding for the past 10 years, and I've seen success stories where we've created a hospital where there were no hospitals, and now you'll see and you'll hear stories of people collecting money from the village and coming once a month, bringing all the sick people together to the hospital so they can see doctors, and access primary and secondary level care. So it's just, and then the kids are, going to school, they're getting better nutrition, they're more responsive. We're looking at how, and again, you talked about technology. it's been a game changer, you know, especially in social development. I mean, we have better quality education. We have people looking at YouTube videos here. You know, we fund a teacher training program, and all these young 17, 18-year-olds who are just about to finish college are going on YouTube and showing me, you know, amazing teachers all across the world saying, this is what we want to do and this is how we practice. And so it's just the styles are changing, and the youth in India is so dynamic, and
they're being inspired by your work.
Yeah, it's the other way around. Yeah. I come back and I always feel more reaffirmed in my faith that, okay, we're on the right track, and you just meet such great people.
Well, you lastly, know, I think it speaks to the theme of the summit here today, resilience. Yeah. Share a story of resilience for the people of India, primarily those in more vulnerable areas in the slums of India who, you know, are just fighting the good fight every day and just trying to do the best they can for their family and their community. Yeah,
I think it's very, it's an eye-opener. I go back to India 3-4 times a year. I grew up there, and I just, you know, living here is a very different reality for me. I have 2 little girls who study here, so when I go back and even just around where my parents have a house, in the villages around there, and you look at the students and you ask them and you see how much their families are making per day or even per month, and how much they can manage within that small amount. And these kids are still going to school. You know, when we go to meet them, they still wear their best Sunday best outfits. They'll come out, but they're so proud of what they do. And you know, in the north of India is Uttarakhand, a state where I'm from, and in 2013 there was a huge natural disaster there. There was a cloudburst, and it's a religious pilgrimage town, so over 100,000 people were affected over the matter of one day. And because of the landslides, rescue efforts were not able to reach within the first week. And there's some villages where they lost the entire male population of the village because they were all working at these sites. And I've gone and visited with these women, and you know, they're back on their feet. I mean, it's about life has to go on, and we have to do the best with what we have available to us. So.
That's not an example of resilience. I don't know what it is.
Yeah.
Shweta, you are fantastic.
Thank you
for all the work that you do.
Thank you.
And I look forward to actually going and seeing your talk later.